Here we are, back at the operating room with our electrosurgical system. Because you, as the manufacturer of our electrosurgical system, also have the obligation to prevent any reasonably foreseeable misuse of our device, you need to inventory these misuses and their risks too. So let's repeat the process we went through for the risks during intended use, but this time, for each of the use phases, we will look for one example of a misuse in one of these 6 aspects of intended use. Remember them? So let's start again with phase 1, preparing the device for use. You may have noticed that the 3 connector ports are identical, so it's quite foreseeable that at some point, someday, the user is a bit distracted, maybe thinking about their vacation starting tomorrow. If the surgeon plugs in the scissors in the foot switch port and vice versa during surgery, the scissors won't activate when the pedals are pressed. And we already saw in a previous video what bloody scene that could cause. In phase 2, connecting the patient, it would be good to check if the patient doesn't have a pacemaker, because using the scissors on such patients may damage or affect the pacemaker due to the currents running through the patient during use of the electrosurgical scissors. And that may of course lead to cardiac arrest. In phase 3, insertion of the scissors into the patient, step 3A prescribes that when using a trocar, it must have a working channel diameter of 5 mm. But imagine a slightly smaller one of 4 mm being used. The scissors of almost 4 mm diameter may still get in, but will slide with much resistance in the trocar, making it hard for the surgeon to move the device during surgery and quickly react. Due to that, they might accidentally cut tissue too little or too much. In phase 4, the actual surgical work happens. But it happens very often that during surgery, the situation changes, and the surgeon, for example, has to cut a bit of bone to get to the soft tissue that should be removed. Such situations can be stressful. Or maybe the surgeon just wants to be done fast to get home in time for his wife's birthday. So it can happen that the user attempts to cut hard materials like bone with the scissors. That might blunt or even break the scissors, and that could delay the surgery or even cause injury to the patient. For phase 5, retracting the scissors, we look at an aspect of misuse that is relevant for all use phases. Misuse by using the device in another than the intended environment. It is unlikely that someone would use the device underwater. But what if it is used in a field hospital in a very humid or wet environment? That may already cause short circuits in the generator. And maybe even less obvious, if the disposable scissors are stored in a too humid environment, they may oxidate and malfunction, or the sterility may be gone if the packaging gets wet and breaks open. Phase 6, turning off and decoupling the device, must be done in the right way to keep things safe. That's why the surgeon gets proper training before using the device. But the surgeon rushed home for his wife's birthday and told the cleaning nurse to wrap up because she should have seen him do it very often. But the nurse did things in the wrong order because she was never trained for this, so the device was still on and connected while she cleaned the foot switch and pressed it while removing a bloodstain, which activated the scissors and set the operating room on fire. Now, the hazardous situations that we treated in this video were just some examples of things that could go wrong due to misuse. As a manufacturer, you will never be able to prevent all ridiculous kinds of misuse, but you should at least do whatever you reasonably can to prevent any reasonably foreseeable misuse. Hey, and maybe you can already think a bit about how to prevent the 6 examples that we just discussed.